Good morning and welcome to our first ever virtual annual meeting of National Academy of Medicine. I'm coming to you live at the National Academy's building. I thank you so much for attending. We're making history. This is the first time our annual meeting is taking place entirely online in the midst of a global pandemic. Let me begin with a huge congratulations to two NAM members who received Nobel Prizes this year. Harvey Alter, who received Nobel Prize in Medicine or Physiology, and Jennifer Doudna, this year's recipient of Nobel Prize in Chemistry. Harvey's discovery of the virus that causes hepatitis C has saved millions of lives, and Jennifer's discovery of CRISPR-Cas9 gene editing techniques will change the future of medicine. So congratulations. Now, these Nobel Prizes and announcements are one of the bright spots in what has been a very difficult year. This past year, we witnessed the triple existential threat of COVID-19 pandemic, systemic racism, and climate change. You heard me say last year that we must not be complacent, and NAM must be prepared for the future. And now recent events have demonstrated all too well that complacency is no longer an option. COVID-19 has taken more than 1 million lives all over the world and infected millions more. COVID-19 is a health crisis, an economic crisis, education crisis, and a social crisis. On top of this, the senseless killing of George Floyd at the hands of police early this year ignited worldwide protests and social unrest and served as a wake-up call to centuries of racism and injustice against Black Americans and other minorities. And the massive wildfires in California, Oregon, Washington are just the latest of loudest signal that we ignore climate change at our own peril. Like the COVID-19 pandemic, the consequences of climate change will be most severe in many of our most vulnerable citizens. Abraham Lincoln said, "You cannot escape the responsibilities of tomorrow by evading it today." Well, 2020 is showing us that tomorrow has arrived. We're living the consequence of years of evasion and neglect on so many fronts. As painful as this year has been, I believe we can make this a turning point. 2020 can be known as the year that sparked a new resolve in all of us to face our responsibilities today. As individuals and as the NAM, it is time for us to act and to lead. Together, we can reverse course of decades of woefully insufficient action and investment in our public health systems and our national and global emergency preparedness. This year can mark a new beginning in reckoning with our shameful legacy of systemic racism and structural inequality. And this can be the year that we begin to reverse years of neglect and inaction on climate change. Health and medicine are the intersection of every one of these crises. I know that you, like me, firmly believe that science and medicine offer solutions that can save lives, reduce inequity, and create a better nation and world for generations to come. I'd like to discuss our responses to these existential threats. First, the pandemic. You know, if there's one piece of good news to come from this crisis, it would be the way our science community have galvanized like never before around finding solutions. Researchers all over the world have united to better understand this novel virus and work toward developing vaccines, diagnostic, and therapeutics, often setting aside competition and individual interests. Science and public health officials are working really hard, but often under great stress. Indeed, amid reports and incidents of political interference in science and public health guidance, I, with Marshall McNutt, president of NAS, recently issued a public statement that expressed our alarm, especially at this critical time in nation's response to the pandemic, which depends on trusted science and public health. And this is the quote I I won't have time to read all of it. I want to highlight the last part. Any efforts to discredit the best science and scientists threaten the health and welfare of us all. It's painfully clear that science and medicine alone cannot provide all the answers. It takes trust, leadership, strategy, and solidarity. COVID has challenged our understanding of pandemic preparedness and response. Before COVID hit, the US ranked number 1 in Global Health Security Index, the most prepared nation in the world for a global health emergency. With COVID, we are one of the poorest performers in our response. Without strong leadership and a national coordinated strategy, it is impossible to mount clear and effective responses, earn public trust, and take strong proactive measures to control the pandemic. In this highly fragmented and politicized time in our nation, the NAM is demonstrating leadership. We are the nation's premier academy for health and medicine and one of the most trusted advisors. We can and must step in and provide desperately needed direction, even when others won't. Indeed, our academy is rising to this challenge, working nationally and on the global stage to address these complex issues. Our work is organized into the following areas: leadership, communication, connection, engagement, response, and recovery. So let me talk about leadership. The NAM and national academies have taken strong leadership role responding to COVID since the very early stages of this pandemic. We established a standing committee on emerging infectious disease led by my predecessor, Harvey Feinberg, to engage regularly with the federal government on key issues related to the pandemic. To date, the Standing Committee has provided 15 rapid expert consultations, a new quick turnaround product to advance on urgent questions such as crisis center of care, virus shedding, antibody response, and laboratory testing. The rapid expert consultations have had a demonstrable effect on decision-making at the national and state level. More recently, the NAM convened an expert committee to address the issue of equitable COVID vaccine allocation. So even with the optimistic scenario of having an effective vaccine and a safe one by late this year or early 2021, it's unlikely there will be enough doses for the entire population in the first few months. Therefore, it's important to have a well-thought-out framework that will help determine who should receive vaccine in what order, based on science, public health, social factors, and equity. Importantly, the allocation framework must be developed independent of political and other undue influences in order to earn the public's trust. I believe this is why NIH and CDC came to us, the National Academy of Medicine, to independently advise on an overarching allocation framework. Importantly, the vaccine allocation framework explicitly addressed a high-risk, vulnerable population and health inequities. I want to thank committee co-chairs Bill Foege and Helene Gayle and all the members of the committee who dedicated tremendous time and expertise over the last 3 months. Their report, which is out, is extremely well received by all. To build public trust in COVID vaccination, we developed a robust public engagement strategy right from the start, including opportunities for public feedback on the discussion draft report before it was finalized. And now, with the release of the report, we're actively engaging the public, the medical community, and others, and will be continuing outreach efforts in the months ahead. At the same time, we can't forget that seasonal or pandemic influenza will soon kick in full swing in the Northern Hemisphere and pose dual health threats. At the request of HHS, the NAM has established an international committee on U.S. and global influenza preparedness to assess lessons learned from COVID to improve influenza preparedness and response, especially regarding vaccine development. Now, let's talk about communication. It is critical that a nation receives accurate and timely and trusted information on COVID. Early in the pandemic, NAM partnered with the American Public Health Association, APHA, to host a webinar series called COVID-19 Conversations. The 14 webinars to date have been widely applauded as a source of trustworthy information to the healthcare community, policymakers, media, and the public. I'm grateful to my co-sponsor, Georges Benjamin, and co-chairs Carlos De Rio and Nikki Lurie for the facilitation of this series. In addition, across NAM and national academies, we've hosted close to 100 webinars, town halls, and workshops on a wide range of topics related to COVID. And we've also published multiple NAM perspectives on important issues of COVID-19. Next, I'd like to talk about connection and engagement. To leverage the experience and innovation of our members, we launched a member engagement initiative to collect and advance your meritorious ideas, and we received over 150 proposals. Thank you, many of which have informed our work, and I really want to thank you for your thoughtful contributions. We have also developed a searchable database of member expertise relevant to COVID to help match your expertise with new and ongoing projects across national academies. And response and recovery. At the NAM, we are incorporating COVID response across all our programs and activities. The NAM's culture of health programs addressing the pandemic's disproportionate effects on the most vulnerable population, particularly people of color. Other NAM programs addressing COVID's effect on mental health, addiction, the elderly, clinician burnout, and other issues. In planning for the future, the national academies have launched a response and recovery strategic initiative, which will bring together multidisciplinary teams to conduct scenario-based analysis in order to build a more equitable, resilient society with better systems and infrastructure. So indeed, the NAM Leadership Consortium is planning a roadmap to study the transformational opportunities for the U.S. health system. NAM has also been active in the global response. This pandemic has starkly illustrated just how interconnected we are globally. We can't truly end this pandemic anywhere until we end it everywhere. We need a strong and cohesive global response if we hope to beat this pandemic. Unfortunately, most countries have been focused on tackling the consequences of the pandemic within their own borders. COVID has revealed the cost of a failing multilateral system. So, moreover, efforts to weaken and defund the World Health Organization have hamstrung this key UN health organization in charge of international COVID response, just as many countries are counting on it for help. The NM spoke out on the importance of sustained U.S. support for WHO, especially in the midst of a pandemic. Simply put, the U.S. cannot fight this pandemic on its own. NAM members, Jeremy Farrar, Chris Elias, Tony Fauci, George Gao, and I serve on the Global Preparedness Monitoring Board, which was co-convened by WHO and World Bank in 2018 after Ebola crisis, in order to monitor global pandemic preparedness. In March, the GPMB called for the immediate injection of at least $8 billion in new funding to support development of vaccines, drugs, and diagnostics for COVID. The GPMB call triggered the European Commission President Ursula von der Leyen to lead the coronavirus global response pledging event, which had the participation of over 30 heads of state, philanthropists, and global leaders. In a mere 7 weeks, the pledge effort raised a total of almost $18 billion. In addition, an unprecedented collaboration between WHO, World Bank, Gavi, Global Fund, CEPI, and G20 countries, which is known as Access to COVID Tools, or ACT Accelerator. It is aimed at accelerating global development of testing, vaccines, and treatment. I serve on the ACT Accelerator steering group called the Principles, along with Chris Elias and Jeremy Farrar. The act itself had made impressive progress towards establishing a multilateral mechanism for end-to-end research development, procurement, and equitable allocation of vaccines, diagnostic, and therapeutics for all countries, rich or poor. Finally, the NAM's convening dialogues among global leaders to examine how to achieve global solidarity through improved governance, sustained financing, and global public good in the future. Now I'd like to turn to structural racism. As I said earlier, COVID-19 pandemic has shown a harsh spotlight on national and global racism and its insidious consequences. In the US, predominantly black neighborhoods are experiencing as much as 3-fold higher infection rate and 6-fold higher death rate than other communities. Disparities also are striking among Hispanics and Asian Americans. This is not a fluke. There are multiple factors at the heart of these inequity, ranging from uneven access to care, inadequate or overcrowded housing, a likelihood to be in frontline jobs that carry more risk, and a high prevalence of chronic health conditions. But the underlying root cause is structural racism. As health and medicine professionals, we recognize that structural racism has long been a public health crisis in its own right. So under a Culture of Health program, in collaboration with Robert Wood Johnson Foundation, we produced a 2017 report that succinctly summed up the issue. And I quote, "Addressing and putting an end to health inequity would only be possible if society and decision makers broaden their view of health to fully grasp how steep and unjust disparities in social and other conditions limit, thwart, and even destroy some people's ability to live healthy and full lives." End of quote. At the NAM, we're committed to tackling this important issue. 3 years ago, we revised our mission statement to explicitly include advancing health equity as a priority. In the aftermath of George Floyd's death, we have urgently ramped up our effort to confront this issue. Immediately after the tragedy, I, on behalf of NAM, issued a statement addressing structural racism and social injustice. I told my staff that I'm committed to ensuring that all people, and especially people of color, feel safe and supported while working here. I committed myself and the Academy to listening, learning, and working with all. I committed to using our platform to improve the lives of people who experience disproportionate health disparities as a result of socioeconomic inequity, bias, and structural racism. In this context, we are prioritizing racial equity in all NAM programs. Earlier this year, the leadership and staff of NAM and RWJ Foundation participated in several workshops to better understand the root causes of racism and the role it plays in health inequities. From our joint work, we'll be targeting strategies to advance health equity by advancing policies that dismantle structural racism. Furthermore, we're also committed to making NAM's internal culture more equitable and inclusive. At the NAM and the national academies, we have a lot of work to do to increase racial, ethnic diversity among our staff and our membership. But we are committed to this work. We have launched a staff committee on equity, diversity, and inclusion. Several years ago, we established a membership diversity task force. We started to make progress. This year, for instance, 35% of our newly elected members come from underrepresented minority groups, compared to 16% in 2019, a new record for us. 38% are women and 30% under age 50, another record. And we're committed to do the same for our NAM staff. We know that change we're seeking won't happen overnight, and this will be a continuous journey. But we are committed to advancing diversity, equity, inclusion in our work and within our institution. Now I'd like to focus on climate change and the very real societal and public health threats that it poses. After decades of human-induced climate change, we're facing real consequences. The latest report from the Intergovernmental Panel on Climate Change predicts that in the absence of dramatic near-term action, temperatures are on track to increase in the range of 2.5 degrees to as much as 10 degrees Fahrenheit by the end of the century. This will have devastating impact on the planet and populations globally. But we don't even have to wait to the end of the century to see what's happening already before our own eyes. The most recent National Climate Assessment highlights the fact that recent years have been record-breaking climate-related weather extremes, and the last 3 years have been the warmest years on record for the globe. A warmer world will bring with it an increase in heat waves, wildfires, hurricanes, droughts, rising sea levels and floods, and other extreme events. Severe heat and wildfires have raged through California, Washington, and Oregon. In California alone, more than 2.5 million acres have burned so far this year. The fires have killed at least 30 people this year and caused multi-million dollars of damage. And no doubt, we see other adverse effects in the months ahead. But extreme events are not the only threats. Climate change will have adverse consequences on livelihood, public health, food security, and water availability. This, in turn, will impact human mobility, likely leading to an even greater rise in scale of migration and displacement. Negative impacts on food production will further contribute to societal and political instability. And all these effects disproportionately fall on the most vulnerable, the low-income communities, people of color, young children, and chronically ill. Now, although the national academies have worked on advancing science on climate change, focusing on human health impact is new for our institution. Many NAM members have urged the Academy to take this on. Last year, a new member interest group was formed with enthusiastic participation. Also, in anticipation of 50th anniversary of NAM, climate change was identified by a high-level committee of distinguished leaders as one of 5 big ideas for the future. Indeed, human health and climate change has now been identified as a high-priority issue for NAM going forward. As a first step last December, we collaborated with the National Academy's Climate Communications Initiative and the Burroughs Wellcome Fund to convene a meeting of experts to review the issues. Importantly, I asked Judy Roden and Phil Pizzo to chair a planning group of experts to develop a signature initiative on human health and climate change for the NAM. Based on the work, I'm pleased to announce today that the NAM will launch the Grand Challenge on human health and climate change, a 5-year multinational, multi-million-dollar strategic initiative. And this will be the second Grand Challenge of the NAM. Through bold thinking and radical partnership with public and private sectors, this signature initiative will focus on 3 preliminary objectives. Develop a comprehensive and long-term roadmap for a transforming system such as healthcare, transportation, infrastructure, energy, which impact or are impacted by climate change with a focus on human health, well-being, and equity. Second, mobilize a full spectrum of actors, institutions in the health community and health sector, along with those in other sectors, to reduce the health sector's environmental impacts and commitment to sustainable transformation. The first area for action is decarbonization of the health sector, an ambitious but an important goal. Third, launch a global competition to foster innovation, interdisciplinary research, and actionable solutions at the intersection of climate change and human health. These areas will be further considered by the steering committee going forward. The initiative will be global in scope, but will emphasize what the U.S. can and must do as a global citizen. So, the crisis I spoke of today, pandemic, systemic racism, climate change, pose extreme threats to society and human health. The stakes of society are about as high as they can be, nothing less than the future of our nation and our planet. Each one of us must do our share. Our strength as National Academy of Medicine is the ability to break down silos that may divide us. We're focusing on these complex challenges at today's meeting, the scientific meeting, so that we can together bring our collective expertise and leadership to bear on identifying advancing solutions. The National Academies were created for moments like these. We have helped steer society through many crises, including the Great Depression, 2 world wars, and the 2008 financial crisis. Today, it's clearer than ever that our mission to provide scientific leadership to the nation and the world, to advance evidence-based solutions for the most urgent and complex challenges facing humanity, has never been more important. And of course, our other work at NAM has not slowed down. So I'd like to thank our staff, members, and volunteers who worked so hard to support our mission. It's truly, truly appreciated. Last year at this annual meeting, we launched the Grand Challenge on Global Competition for Healthy Longevity, which was attended by the innovators all over the world. Just last week, we announced the winners of the Catalyst Awards. 49 countries and territories got involved, and globally received over 1,500 applications. Using a 3-tier process, by the way, involving many of you as reviewers, we selected 154 awardees globally, with 21 in the US, each of whom received $50,000 for novel, bold ideas to extend human health span. You know, the funded projects came from a range of sciences: biomedical science, engineering, social science, digital technology, and many other disciplines. And of course, this is the first round, and we'll be starting the second round very shortly. So I'm sure you've heard the saying, life happens when you're busy making other plans. Before pandemic hit, we certainly had many other plans for 2020. This year marks the 50th anniversary of founding of the IOM, and of course, 5 years of National Academy of Medicine. We had anticipated celebrating this momentous occasion in various ways throughout the year, especially at this meeting with a big gala. Of course, the coronavirus had other ideas, and we've just had to adjust accordingly, and we're so glad we did. So we plan to celebrate our 50th in person with you next year in Washington. 2020 has been quite a year, and it's not over yet. And even the pandemic did not stop us from coming together today. You join me because we know that together we can make what seems impossible become possible. We can and will blaze a trail to recovery from this pandemic. At the same time, we can create a stronger, more resilient, and more just and equitable society for all our citizens. I can't think of anything more important than that or more necessary. So thank you. Thank you for your service, commitment, and support. You know, it is a real privilege for me to serve this wonderful academy and you, the members, and to serve the nation and the world. Thank you very much indeed. Thank you.